Hi, welcome back. I'm Steven, your friendly neighborhood anesthesiologist, here for Ask an Anesthesiologist. I'm answering your questions about anesthesia. Today, I want to talk about things that are important for your anesthesiologist to know before they put you to sleep. It sounded really dramatic. We aren't always putting you to sleep. There's many different ways to do anesthesia. Most commonly, what people think about is going to sleep and waking up. That's why I said that, but it was kind of a dramatic, for dramatic effect. But several things that we think are important as anesthesiologists that we really need to know before we provide anesthesia. So this is important because, you usually see your surgeon before you get operated on. You'll see them in the clinic. They'll talk about your medical history. They'll talk about the plan for the surgery, and then they'll schedule a day for your surgery. Sometimes in some places, they will then refer patients for a pre-op workup by their primary care doctor, or in some places by the anesthesiologist. The places I've worked, we've had a pre-op anesthesia clinic, and we're able to look over your medical history, answer questions about anesthesia before you show up. But in a lot of places, you're going to show up the day of your surgery. You'll meet your anesthesia team taking care of you. The anesthesiologist is going to ask you questions about your medical history and talk about the plan for anesthesia. So what is important for us to know? There's usually 5 things that I start with by asking my patients. 1, when is the last time you ate or drank? I have a previous video about NPO, or nil per os status. That's the status of how long have you not had any food or water, or food or anything to drink. We want your stomach to be empty when we're inducing anesthesia to prevent other complications. Ideally, for most foods, 8 hours is a safe bet. Some places will have you NPO, or nothing to eat, for 12 hours or since midnight. The standard is 8 hours for full meals, 6 hours for light snacks, which would be like a piece of toast with no butter, 4 hours for breast milk, and 2 hours for clear liquids. So I ask patients, when's the last time you ate or drank? Because sometimes we'll have to delay the case if the patient's not appropriately NPO. If they have a full stomach or whatever, sometimes, and it's safe to, we'll have to delay the case or reschedule or cancel. So that's the first thing that I usually ask the patients. I ask, do you have any allergies? Now, I know some patients are wondering, did you look at my medical history? Yes, I did. I looked at the chart. Usually the allergies are posted in multiple locations, and there's hopefully by this point an allergy wristband on your arm. It's on the chart, but I like to hear verbally from the patient, from you, do you have any allergies? So it can correlate right then and there. It's just another check process for me. I will ask if you have had any problems with anesthesia in the past, or if your family members have had any problems with anesthesia in the past. There is one very serious condition that I'm usually looking for. It's called malignant hyperthermia. I'll probably make another video about that. But basically that is an allergic reaction to the anesthetic gas that we use and a couple of other agents. It is it has symptoms of a very bad fever in the operating room, and some people die from it. So we'll ask, do you have any family history of something bad like that happening, any anesthetic complications? Malignant hyperthermia is the one we worry about probably the most. It's very rare, but there is a hereditary component. So if your family has had it, then there's a chance that you can have it too. Other problems with anesthesia in the past: did the anesthesiologist have difficulty placing a breathing tube, or do you have a difficult airway? Did you have poorly controlled nausea and vomiting after surgery? So postoperative nausea and vomiting is something that we can treat, and there's other mitigating things that we can do to decrease that risk if we know about it ahead of time. Those are probably 3 of the biggest things that I'm asking about when I ask patients, have you had any complications with anesthesia in the past? I ask about functional status. Are you able to walk up 2 flights of stairs without any chest pain or shortness of breath? That's a judgment of your metabolic equivalence. And we ask that because going under a general anesthetic is the equivalent of about 4 to 6 metabolic equivalents. It stresses you out about as much as walking up 2 flights of stairs. That's an easy way to put it. So if you're out of shape to the point that you're unable to walk up 2 flights of stairs, then we need to fully evaluate you to make sure you're safe to receive anesthesia. Now, if you've been unable to walk upstairs for a while, or sometimes it's limited by pain, say you're having a knee replacement done, so you're unable to walk upstairs and it's occurred over time because of your disability with your knee. That's a slightly different issue, and that we'll discuss. We'll talk about it and develop a plan for that. But if a month ago you were walking around normally and now you have trouble breathing, you're huffing and puffing, wheezing, you're retaining water, swelling in your lower extremities, that's something that we need to know and talk about, because it could be signs of problems with your heart or your lungs that needs to get fixed before you go under anesthesia. Finally, I ask patients about your medical history, any medical problems. That's usually how I word it first. Again, I've already looked at the chart for you. I know what your medical problems are. I usually ask it in a very broad way. Do you have any medical problems? Because whatever you're concerned about the most is what you usually will tell me. After that, I'll take whatever you give me. I'll ask, do you have any heart problems? And then I go through high blood pressure, chest pain with activity. Do you have trouble laying flat? Do you have any lung problems, any asthma, sleep apnea, COPD? Do you smoke? Talk about the stomach. Do you have any reflux or heartburn, any diabetes, any kidney problems? Those are some of the common medical issues that I ask patients about. And then I'll discuss the plan for anesthesia once we've discussed all of your medical histories and those other things, those other questions that I ask. I put all those things together and am able to develop an anesthetic plan that would keep you safe and comfortable during surgery. So that's why it's important for me to get this information from my patients. Sometimes it happens before surgery, oftentimes it's the day of surgery. And then if your case or your operation needs to be canceled or delayed for some reason, please know that we do that for your own health and safety. It's very, very inconvenient for you to have to come back and go to surgery a different day and not eat for 12 hours. We truly do understand that. And I honestly hate inconveniencing patients, but anesthesia and surgery can be very dangerous if we don't take the proper precautions. So if we need to delay or reschedule your case, please understand that we are doing it because that's what we think is best for your health and safety. What questions do you have about medical problems and their effect on anesthesia? What other questions do you have about anesthesia in general? Again, I'm Stephen Bradley, your friendly neighborhood anesthesiologist, here to answer your questions about anesthesia. Drop your questions below in the comment section. Let's see if I can point down. Yeah, drop your questions below in the comment section. Hit subscribe, like the video. I'll try to get back to you or make a video for whatever questions that you want answered. Thanks again for watching, and I'll talk to you soon.